So I'm Dr. Saqib Shahab. I'm the Chief Medical Health Officer, Government of Saskatchewan, and just wanted to provide a brief update and answer any questions you may have today. So regarding the COVID-19 situation, as of today, we now have 4 new presumptive positive cases, bringing the total to 20 in Saskatchewan. 8 cases are confirmed and 12 are presumptive. 6 cases are in the Saskatoon area, 9 are from the Regina area, 1 case is from the center rural areas, 2 cases are from the south rural, and 2 cases are in the north. To date, 2,561 tests have been performed. And in Canada, as we know, there are 744 cases, out of which 735 are confirmed. In terms of testing numbers, a significantly higher number of tests throughout Saskatchewan. So I'll maybe just stop there and see if there's any questions. We've all seen the news release, so I won't read the news release.
You mentioned they were travel related. Where are they traveled from?
I may not have all that information today, actually. So it took some time, but there's one case that is a household contact of one of the cases, and there's one case that was related to an event in Edmonton, and the rest I don't have that up-to-date information. In future, what we'll be doing is we will be providing a tabular summary starting next week, where instead of listing all the new cases, we'll be summarizing how many are travel-related, and if so, travel from where, although that's becoming less and less relevant. And the rest will be mentioning if there was any large events where cases were linked to, or if there was any cases which are household contacts. And of course, like I said yesterday, we are closely watching if we see any local transmission without any link to a known case or travel. So far, we haven't had any of those situations, but that's another area that we want to keep reporting on.
Dr. Alan Wu, President of the Saskatchewan Medical Association, he says that he's in self-isolation. He had recently been to Edmonton. Is that the Edmonton case?
I can't confer any details, but I do realize I did receive, like many other physicians, an email from the president, and I actually did reach out to him, and I have his permission to confirm that. But beyond that, I would not like to discuss any particular details of any case in terms of potential exposures. But having said that, if we realize that there is more than one case related to an event, we will be disclosing that.
The SMA has said that between 50 to 60 physicians from across Western Canada usually go to a Boncheville event in Edmonton. That Dr. Wu said that he believes that's where he contracted this or was exposed to it. Does that mean now that those 50 or 60 physicians across Western Canada are in self-isolation, and what does that mean about the response to COVID-19, as it seems physicians are quite critical to have in this?
Yeah. So my understanding at this point is just like the earlier event, that was an event in Vancouver, where there was 14,000 people had attended a large conference. My understanding at this point is that there was an event in Edmonton where there were physicians and maybe others, and obviously this investigation involves 2 provinces at least, but all that information is being collected and communicated to all the provinces from where people may have come to that event. And what happens as part of this case content investigation is details are sought about where each of the participants were, that certain people sit together as a group and mix more than others. And based on that, a determination will be made shortly in a day or two that, does this involve all persons who attended, or were people attending in groups, and is it more of a risk for people who are more closely tied with each other? So that's how the investigation progresses. So at this point, it doesn't necessarily mean that initially all people are alerted that they need to wait for that assessment, so they will be in self-isolation, but ultimately it doesn't mean that everyone is identified as a close contact.
Can you say, though, like how many doctors from Saskatchewan had gone, and how many of those doctors
at this
now
point, that information will be available with the local public health teams. I don't have that. But I will certainly bring that once we have that investigation. Yeah.
Arthur and then Lisa.
Do you know more broadly, even independent of this particular Edmonton situation, what kind of impact contact with COVID-19 patients is having on the healthcare community, both for physicians and other healthcare professionals, and how worried you are about how that might impact response.
So we talked a bit about that yesterday also. So I think, first of all, we have to recognize that there are people who are in essential work, frontline work, that includes all healthcare providers, physicians, nurses, pharmacists, dentists who provide essential services. And obviously, they are at somewhat higher risk. They, do use appropriate precautions. But having said that, it's really important, as we said earlier, there are several physicians who are in isolation because an individual who was unwell may have presented and would not have called ahead. So when you present and don't call ahead and sit in a waiting room or go to a physician's room, the physician may not be wearing a mask all the time because, many of the patients would be there for chronic illnesses. So if you haven't pre-announced that you have a cough or a fever, you then expose the healthcare provider and maybe other people. So I think that's just something we need to really pay special emphasis to, that, please call ahead if you need to see your primary care provider, have to go to an ER. So that's one area. And the other is, healthcare providers. There's 50,000 healthcare professionals in Saskatchewan, including physicians, nurses, others. Like everyone else, they're also part of the community. So, exposure can happen as part of work or as part of the community. But then that ongoing self-monitoring, so that as soon as you become symptomatic, you isolate, is really important, because that's the most important thing physicians can do, healthcare providers can do, and all of us can do. Self-monitor ourselves in an ongoing way, not just if you've traveled. Avoid large crowds going forward now. We really yesterday announced not more than 50, but that's not just, as little as possible. And if at the first sign of cough, fever, isolate and seek advice about testing.
In those cases where, someone had shown up to a doctor's office without prior announcement and had then tested positive, do we know how many physicians and other medical professionals are currently self-isolating in relation to those cases, and if any tested positive?
So I'm aware of actually two situations where that has happened. So it may be a healthcare provider or their staff. At this point, I don't have information on has there been any secondary transmission in those settings, but we can try to see if once you start, because as the numbers increase, it's hard to list everything. We need to start making more tabular data about how many were travel related, how many household contacts, how many this would be a nosocomial transmission in the healthcare setting, either from a patient to a healthcare provider or the reverse. And so I think we need to start tabulating that from next week.
You said that you're aware of two situations. Is that two facilities or two medical professionals?
Two facilities, I think.
So there may be more medical professionals.
I think these investigations are ongoing. At this point, I am aware of two, but we need to tabulate this in a more systematic way.
Sorry, Lisa first.
What kind of consequences are there for businesses that don't close under these regulations or?
Yeah. So, we just announced our more stringent measures yesterday. And obviously, our expectation is that most businesses will comply, either to close if that's what's in the declaration or the order, or to limit the amount of people who can be at that establishment. Obviously, there are opportunities for public health to pay visits, either as part of routine inspection or on the basis of a complaint. But having said that, I do want to say that businesses are one thing. They themselves don't pose any inherent risk. The risk there is from crowding. And we've heard two sets of issues in terms of people who are coming back from Canada. One is, of course, we always get information about so-and-so came back and they're not self-isolating and so on and so forth. Public health does try to follow where they can, but really this just is up to individuals who are coming back to, self-isolate for the 2 weeks. It's very hard sometimes. You just come back after many months or after a nice holiday. You're excited. You want to meet your friends and family. But that is really important. And on the other hand, we've also heard reports where, someone's coughing and then they're pestered about, do you have COVID, why are you coughing, why are you out and about. Some people may have a chronic respiratory illness. So we just need to, I think, be careful about, how we judge someone who may have a cough or just another respiratory illness. But I think ultimately this cannot be policed in terms of this is becoming more and more common. It will become even more common, and we want to prevent this taking off in a big way. And the only practical way of doing this in our setting is that we all have to self-monitor, isolate when we're symptomatic, seek testing if required, otherwise stay home. And if you're fine in a few days, it may be COVID-19, maybe something else. But if you test positive, especially if you have more severe illness, then most people now, we're hearing from other provinces, do well and they clear the virus within 10 days. And then, there's a check-in with public health. Repeat testing is not always required unless you are in healthcare, for example. And
Businesses, though, if businesses aren't following the measures.
I think public health can follow up if there's a complaint made, but we really want this to be the minimum. I think public health is very busy trying to manage cases and contacts, and we don't want this expectation that it has to be something that's policed. But obviously, if there's a complaint, then public health can be informed, local public health.
Fines or anything?
There can be fines, fines and other penalties, but again, our hope is that this, for the most part, should be voluntary compliance. And so far, what we've seen is actually many businesses, many event organizers have been ahead of the order, actually. They've been slowing down and cutting down, even ahead of the order coming yesterday.
Can you say kind of which curling club, I know you mentioned you spoke to Dr. Alan Wu, but can you say which curling club, just because we are live and people are going to be asking, which one it was that he believes he contracted?
I don't have that information. This investigation is done jointly by us for people who are in Saskatchewan, but by our colleagues in Alberta. But as soon as that information is available, it'll likely be posted online in Alberta, and we will have a link to that.
This is to kind of further Lisa's question a bit, but public leaders have been calling for the event limit to be dropped. And I understand you're saying, just because it's 50, don't pack a room with 49 people. But to ensure that crowding doesn't happen beyond the handful of people you recommend, will you consider minimizing it to 20 or far less than 50?
We've actually had those discussions early this morning, actually, not just within Saskatchewan and within government, but also with our partners, because some jurisdictions like Quebec have actually, and I think BC are becoming even more restrictive. And so we've had those discussions this morning, and we'll have to see based on where we are at, should we move to that early, maybe this week, or maybe see how we are in terms of our cases. But we've had that discussion.
I guess. And what are you waiting for necessarily? Like, why not do it now? Why not have done it yesterday?
Yeah, I think there's several things several of the questions that have come to us, and I don't know if that is going to be asked, but we've got a lot of questions from personal care services, about should you go to get your hair cut and those kind of things. That's one-to-one. And I think what we can say at this time is that crowding is a problem, because if you're really with less than 1 meter, many people, that's always a problem. If you are well, someone who's providing you services fine, potentially that's less of a risk because you don't really transmit unless you're symptomatic. But having said that, someone can have mild symptoms and still go for a haircut, or someone may still end up at work and not realize till evening that they're not that well. So there is a bit of risk there. And we're looking at all these situations very carefully. We really want to obviously minimize large crowds, and now we've gone to even less than 50, and even in restaurants that can have up to 50 people or half their capacity, we want to maintain that separation. And I think we need to look at the at ongoing restrictions very carefully in terms of, obviously, are they going to prevent further transmission, but then how do you get some services that are important? They may not be essential, like food, but they are important to us on a day-to-day basis. And I think I'll have to say again that I think ultimately it has to also come down to all of us being very aware of our own health and symptoms, and really self-isolating ourselves and our children at the first sign of illness. That is actually the most important thing at this point.
I'm hearing from, sorry, I have a bit of a stutter. hearing from the Sun Nurses Union that medical professionals, like others, are not being tested until they show symptoms. And I'm wondering, how is that responsible, given that they're the most likely to come into contact with patients that might have COVID-19, and we know, based on recent studies, that some symptoms are so mild that they might not even be noticed.
Yeah, and that's a really important point. And I think the first thing we have to realize is that if you are a healthcare provider wearing appropriate personal protective equipment, you are not considered exposed if you're providing care. But as you go home, as you go around, you may still get exposed. So you have to continuously self-monitor, because you may still get exposed if you're out and about. And actually, if you're using proper PPE, you may be safer in the healthcare environment seeing a patient, because you're very self-aware than if you're out and about and touch your eyes, nose, or mouth. So that's one thing. Second thing is the data that's been collected so far from especially other countries who have seen thousands of cases, is that by testing someone who has been exposed is of no value, because the test is negative. And if one person coughs less than 1 meter apart on 4 people, those 4 people may be considered close contacts, because but you can't predict who will actually get infected. It's just like a lot of other things, that how many droplets actually made contact with the mucosa versus just skin. Landing on skin is not an issue. And then the early symptoms actually can be malaise, feeling tired, but the test may not be positive. Once the virus replicates in the respiratory tract, lower respiratory tract, you get a cough, fever. That's when the nasopharyngeal swab becomes positive. So even when you start getting symptoms, the recommendation is to wait a day or 2 to get tested. But for healthcare workers, we are trying to make sure that they are able to get tested quickly, because if you have a fever, you should not be working in any case. It could be COVID, it could be something else. If you just have a cough and it's going to settle in a day or 2, it is important for you to get tested. And if it's negative, you are safe to go to work. But if it's positive, you have to wait out the 10 days till you clear the virus. But you have to wait till the symptoms are really there for the test to be true positive. Otherwise, it'll be a false negative.
You said that you're trying to ensure that those tests are done quickly. What happens in the meantime to a nurse or a healthcare professional who's waiting for results?
They are on isolation. They have to be on isolation, yeah. They can't continue working. Once you have symptoms, you have to stop, stay at home. And even if you develop symptoms, not just as a healthcare provider, but anyone at any work setting, if you develop symptoms, you should stand up, wipe down your surfaces, go home, and then let your manager know. You shouldn't really wait till 5 p.m. or hang around to see. You should leave and then see what's happening.
Do you have any updates in terms of the situation around swabs and other testing supplies? I mean, are there any orders that have come in? You said that there may be pressures coming in the coming days as we ramp up testing.
Yeah.
Where are we with regards to that now?
At this point, overall in Saskatchewan, we are okay. But there is, multiple assessment sites are coming up. We have to make sure that everyone has enough swabs that they need for the next day or 2, just that the distribution is fine. But obviously, if there's a lot of testing pressure due to a variety of issues at one location, they may get a little tight. But at this point, things are going well. It's like getting the flu vaccine out everywhere. There's a whole distribution. So at this point, things are going well. But I can foresee that at future time, there may be some pressures in which testing may have to be prioritized for either people who have more severe symptoms or people who have to get back to work if they're negative, like healthcare. And others may be told, like in some parts of Canada, it's already happening, that if you have mild symptoms, it's no longer important, is it COVID-19 or something else, just wait it out. Most people do well after 8 or 9 days, they clear the virus. So at some point, even in Saskatchewan, it will become less and less relevant to get tested if you have mild symptoms.
Go to Charles today.
We were hearing that a union is calling on for prisoners to be released from jails. Is that something that's being considered?
So actually, just this morning, I had a discussion with my colleagues in other provinces and with Federal Corrections Canada on exactly this. So all institutional settings need to have precautions in place, which include that if you are someone who works in that setting or someone who visits, you are more likely to bring COVID-19 into that institution. And of course, if there are new people coming into a correction setting, this needs to be, protocols in place which are in place to screen people before they visit. But having said that, once someone is in a correction facility, if they were recently exposed, they may present with symptoms. So it is very important that someone with any symptoms are isolated safely and then tested if there's appropriate symptoms and history. That has happened on at least one occasion where the test was negative. It's very challenging sometimes if there's crowding in a setting where everyone may not have access to their own cell. So it is very challenging, but these discussions are happening to make sure that as much as possible you prevent a case in corrections or you prevent secondary cases.
Lisa and Steph?
What's the province doing trying to get information out to travelers? Because we've heard from travelers, one man who said he was on a flight where somebody tested positive who was on the flight and he didn't get any notice. And another man who said that he didn't know that anything was happening when he got back. He was told about self-monitoring, but not that he had to isolate.
So that's actually, that has also been discussed actually just today. Because as you know, initially in the first 2-3 cases in Canada, there was a big attempt that was done to get the flight manifest from the airline to figure out where someone was sitting, and then the 3 rows ahead or 3 rows behind, or if someone was in business class, maybe no one needed to be notified because there's no one 2 meters ahead and 2 meters behind, depending on who was, if it was empty or full. So far, I may be wrong, but in Canada at least, we have not had any evidence of transmission in an airplane. We have had evidence of transmission in the household setting, but airplanes, we have special considerations if someone was coughing a lot or was moving around. But generally, we have not had transmission. But at this point, the strategy is just to post the flight information, and if row information is available, just post that with the understanding that if anyone is now traveling back, previously what is happening was that like 4 weeks ago, if someone was coming from China, Iran, or Italy, and connecting via, for example, London, and then London-Toronto flight, everyone is notified because they're not coming from a risk area, but they may have been a passenger from a high-risk area. Now that every part of the world is considered a risk area, that's becoming less and less relevant. We will start posting flight information, but we have to realize that as this progresses, that is becoming less and less relevant because in many cases, actually, people may come now to Canada and have symptoms that are so mild that they should be self-isolating for 2 weeks, but they may not even realize they have symptoms that are enough to actually seek testing because we've already had situations where we've discussed with individuals, or, you come after a long flight, you feel tired, you have a dry cough because the air is dry. After 3 or 4 days, you're fine. And sometimes that may be the only symptom that you have of COVID-19, and you still may have exposed others. But so you just have to be more aware. Anytime you travel, isolate yourselves for 2 weeks, monitor your symptoms, but also going forwards, keep monitoring your symptoms.
So it would be up to the traveler to kind of seek out that information.
Yeah, we're trying to have a streamlined process because airlines are posting their flights, where there've been cases. Some provinces are posting. We're talking to the federal agency. We would prefer a central site where if you've traveled within the last 14 days, you can check your flight. But we need to streamline that process actually, because even in the news release it's buried. It's not like there's flight information in the news release yesterday, but we want to have it in place that anyone who's traveled can, after coming back, check to see if their flight was notified, and it may not get notified. That's another thing we have to remember. You can become ill within 14 days. Most people become ill day 6 after exposure. So assuming someone got exposed just before they were traveling, they get exposed on day 6, they become ill enough to seek care on day 8, they get tested, it's day 9, day 10. By the time we get that flight information posted, everyone who's exposed is already ending their 14-day period. So it's of limited value, and the main message is if you're traveling anywhere from the world or anywhere within Canada, whenever you're in a crowded situation, if it's an airplane, a bus, a train, consider yourself in a crowd and be especially self-aware that is actually the best message for now.
Doctor, can you provide more details on the northern case, specifically where they were tested, or?
I actually don't have that information. I'm sorry about that.
There's some reports out there that some people who should be self-isolating, say a traveler who came back, and they're, for whatever reason, choosing not to. Are you considering some kind of punishment for people who should be self-isolating but choose to disregard this?
Well, first of all, we're trying to, and I actually, today was a busy day, and that's why I'm late, because I was on a call with with my colleagues in other provinces. This is another thing that came up, that we use self-isolation in various ways. So if you are a case, you are to isolate, because isolation is really used for people who are sick. So you're to isolate strictly in a room in your house for at least 10 days or till your symptoms are gone. And then public health gives you the go-ahead, and then you can come off isolation. So that is very strict. That's the strictest, that you have a fever, cough, your test is positive. You really have to isolate very stringently. If you have traveled back from anywhere in the world, some destination, you're coming back, you are to, the proper term is quarantine. It was done in a very systematic way for people who came back from Wuhan on federal flights or from the cruise ships. They were taken to an Air Force base where they stayed in their own rooms. They could go out for a walk. Kids could go out and play. There was some ability to go out and get some fresh air, but not congregate as a crowd. So everyone was in their own rooms, went out on their own, came back on their own. Special attention to surfaces and all that, which we should be doing anyway. So that's quarantine. We know that people who've come back after a holiday or after 6 months, in the US, it's very difficult to stay in one room. And they may not have to stay that stringent. They can still go for a walk as long as you don't, interact with anyone closer than 2 meters. You certainly shouldn't go into a crowded situation. Even if you're feeling fine and you're asymptomatic, you certainly shouldn't go and visit anyone else, especially people with underlying risk factors. And I know people have come back and they've started chatting with their neighbors within stairwells and hallways. It's just natural, you've seen someone after a long time. And, that's just something you need to just avoid. And obviously, some people know that so-and-so has just come back and they should be self-isolating. Some don't know. I think we just need to give each other some space so that if someone isn't greeting you the way they would have, just give everyone some space and let that 2-week period pass.
So is it safe to say that you're not considering some kind of punishment or anything for people who are supposed to be on isolation or supposed to be in quarantine?
At this point, no. We really want to support everyone to be able to self-isolate, really.
Yeah. I want to also ask, when are we going to see, if and when are we going to see assessment or testing centers outside of Regina and Saskatchewan, and where are we going to see those?
So I can try to give you the list of communities, but I have seen that they are actually present throughout Saskatchewan, actually, quite extensively. But I can try to give that information. I think there's a reluctance to actually post the exact addresses because you don't want people lining up. There's still a process by which you are referred by either Healthline or Public Health or your physician, because there needs to be an initial screen. So what we recommend is you go to the online screening tool first to figure out if you meet the criteria. If you do, then you call Healthline. I understand that's getting more streamlined. And then they will make a further assessment, and then Healthline can refer, your family physician can refer, Public Health can refer. If you work in healthcare, your occupational health services can refer, and then you're referred. And again, you don't want people crowding that assessment center. That's not good, that 5 people standing close together trying to get in. The referral is made in a way that you have a fixed time at which you go, where there's no one else there, and they're expecting you at that time. You go, get tested, you leave, everything is cleaned down. So you want those assessment centers to flow in that streamlined way.
Just to be clear, are there assessment centers?
My understanding they are, and we will try to get you some summary information.
Last question to Arthur.
We're hearing that there may be an upcoming mandate for daycare centers, particularly those attached to schools, to reopen to accommodate children of essential workers. Yeah. Can you confirm whether or not that's the case and define who would qualify as an essential worker?
Yeah. So first of all, I think there's been discussions, and again, I don't know who leaked the agenda of our FPT call, but this was this came up that schools are closed. What about daycares? And smaller daycares seem to be fine, 5 to 7 people in someone's home. There are some daycares that are large, 100 people, 200 people. Can you split up, people who are supervising and the children so that you always have only 5 or 10 people in a room and you don't mix around the children? All the kids go to one room every day and all the supervisors go to the same room so that it's like a small daycare or multiple small daycares. But at some point, I think some provinces have gone to limiting daycare size or closing them. But then, of course, that's a big problem for workers who right now are already pretty tight. They're providing essential work in labs. Labs are running extra overtime, who are doing the test. Assessment centers were not a part of routine care. They've been set up. Obviously, the same staff are providing a variety of additional services. What happens then if they can't come to work because they can't find alternate arrangements? So I think we want to phase that in. And yes, if ultimately we reach a place where most people are supposed to stay at home, either work from home or stay at home because their business has slowed down, you still want people who have to work, can work, and whether then you have someone providing casual, childcare services, or there are more smaller daycares that may be okay to run, or will there be any help that an employer may give or allow for people with the services to get access to daycare? I think all that needs to be considered. I am not, out to speed on where those things are. Obviously, there's other ministries like education who oversee some of that, but that's another thing that I can get some updated information on what the planning is on that.
You said that there are other provinces that are moving to enact these very
Yes.
Restrictive
Yes.
measures for daycares where
Yes.
they're either closed or they're limited
Yes.
to 5 to 7 children. Why are we waiting to do this?
Well, there's several reasons. One is that obviously, and there's a publication just this morning from the US CDC who looked at their few thousand cases. The infection rate seems to be lower in young children under 20. But then the question is, why close schools? So it's complicated. I think it is clear that unlike coughs and colds or norovirus or influenza, this is not primarily transmitted through children. It is transmitted mostly in older adults through close contact. But having said that, there seems to be some sense that by closing down schools and universities and other, gyms, that's a way to slow things down. Daycares could be closed. They will put a pressure on people who are providing essential work. Will this slow down the force of infection? That's not really very clear because daycare is not the incubators of COVID-19.
Perfect, thanks everybody. Thank you, Dr. Shahab.
Thank you, Doctor.